It often happens to parents to pay attention to the slightest actions of their children when they are in the developmental phase. Among the key moments of the latter, learning to walk remains a major milestone that changes the baby's relationship with his space and never ceases to move parents. But the next time your little one walks in front, try checking out how he puts his feet on the ground. If he often happens to do it on tiptoe, it could mean the presence of future complications to come according to the site Pediatre-online. It should be noted that from 12 to 15 months, when the child explores the various positions of the foot, this way of walking is completely normal. Generally speaking, if your child is under 2 years of age, toe walking is nothing to worry about. Indeed, the majority of children experience walking in this way for the first time. Even beyond this age and up to 5 years old, children can continue to do so while learning different ways of walking. After the age of 5 springs, toe walking becomes a topic to discuss with your doctor. The risk is that toe walking will become the only weight-bearing method your child uses when moving around. And if very often it is just the result of a bad habit to correct, it is possible in some cases that the situation requires medical intervention. Usually there is no need to worry. One, when the child first walked on tiptoes, namely that this way of moving did not appear later. However, we must make sure to eliminate the risk of autism, which today is becoming more and more sought after by doctors. In the past, the tendency of physicians to be reassuring has often led to delaying the diagnosis of autism, which should occur as soon as possible. 2, when the child is able to walk stably while keeping his balance, to climb and move normally despite this way of walking. 3, if no movement difficulty is observed. 4, when the child does not feel any physical pain. 5, when after examination by his pediatrician, the child does not present any alarming clinical sign. Monitor the child regularly, every 6/7 of a month. Over the age of 6, tiptoe walking can cause several side effects. Among these, the retraction of the triceps, calves, which, becoming permanent, makes walking tiring, then generates discomfort. When the pediatrician's examination concludes that the flexion of the foot on the child's leg has reduced from 20 degrees to 5 degrees. At this time, special compression boots are used in conjunction with physiotherapy sessions. The goal of this treatment is to stretch the muscles to return to the normal 20 degrees flexion of the foot on the leg. When, although the case is rare, underlying spasticity can also be at the origin of the problem. The latter is potentially caused by a neurological problem to be detected by your pediatrician, whether it is a neuromuscular disorder or at the level of certain circuits of nerve control. More rarely, it can be indicative of the development of a case of autism or psychosis in the child. This is all the more likely if other signs are associated, such as, for example, motor stereotypies, or swirling dance attitudes. Which reminds us that behind this little habit that some might find cute, there is reason to wonder about the medical implications of the question. This is why a follow-up by a specialist in childhood medicine remains important to ensure that a little habit does not actually hide a big problem by exploring the tests that are necessary: blood dosages of muscle enzymes, brain MRI, testing for psychosis.